When health system administrators and leaders are thinking about how to drive that improvement in culture and increase performance in terms of operational, financial, or organizational outcomes for the surgery center or hospital, the first place we recommend starting is having a high functioning OR governance committee. Now, most hospitals have an OR governance committee, and they, the feedback is, well, nobody really comes, or it doesn't get much accomplished, or maybe it's more clinical based versus actually running the operations of the surgical services department within that institution. And we, over these 500 hospitals, have figured out how to really design an effective OR committee that people attend regularly every time, because if you miss that meeting, you miss a lot, right? Key decisions are made in that meeting that are important to those surgeons and to the attendees of the meeting, and so they don't miss it. And so how do you create that high functioning OR governance committee? There's a few steps to think about, but you can take your committee and revamp it. Or a lot of times what we do is we retire that committee and start fresh so that there is a new charter and new expectations associated with it. We recommend that this committee is physician run, where you take an influential and up and coming or highly respected surgeon and a highly respected anesthesiologist and have them be co-chairs, because those two professions are very important to running surgical services. The committee should also be administratively sponsored. And because of the importance of surgical services and the importance that this committee needs to have a high functioning operating room, we recommend that typically be the COO or CEO of the hospital, that's the administrator that sponsors this committee, attends every meeting. The meeting is scheduled in a time that is convenient for people to attend, which is usually very early in the morning, 6:30 in the morning before first cases start. The only way it really can be effective at breaking down cultural friction is to have the OR director, a nursing leader actively involved in helping to set the agenda and in the meeting, and then having most of the attendees be surgeons. And you want them to be those that are ready for change, eager for change, drivers of a high performing surgical services, and a few of those naysayers, because you need to bring them along too. And we found that when you create this structure and you're meeting biweekly, monthly, and really making active decisions in how the OR is run. And so this committee is the sort of the parent committee that sponsors and provides a communication and accountability loop with the underlying subcommittees, with the underlying performance improvement teams, so that if there's an issue within those teams, that can be escalated to the OR governance committee. Or if there's ideas or votes that happen within the OR governance committee, they can be communicated down to those subcommittees so that they can be implemented and executed and sustained across the organization.